Very important to run it with you very quickly now. Nottingham University Hospitals NHS Trust yesterday declaring a critical incident. 4 hospital trusts in the south-east of England declaring critical incidents yesterday. Those incidents mean increasing levels of staff sickness, lack of equipment, more respiratory cases, norovirus. Four, this is really important, trust in the southeast saying there's major problems. We'll say good morning to Dr. Ron Daniels, the Chief Medical Officer at UK Sepsis Trust. Ron, good morning. How are you?
Morning, I'm well. How are you?
I'm good. I was going to say to you, probably different to other people would, we live in an age where you can't see a doctor, where you go to the hospital and these poor people working round the clock, you have to wait about 17 hours unless, you end up in a corridor. I'm not having a go at the med. That's the way the NHS seems. And now it's even worse. What does a critical incident mean? Put it in layperson's terms for me.
It essentially means that particular hospital is at or over capacity. So it means that ambulances are waiting outside with often very sick people inside them. The emergency department can't receive those patients. Once people are in the emergency department, there's not a ward bed available for them. So we used to, if you think back a number of years, we used to have the 4-hour trolley wait that we talked about a lot. That would be a dream these days. We often see quite sick patients in our emergency departments for 24, 48 hours at a time. The system is at breaking point.
I always want to ask the medical profession, not to have an argument, but because I want to get your take. Because one of the things that strikes me is that when you go to hospital and you get by the frustration of having to wait for 4 days, that the job the staff do under the situation that they're in, and whether it's resources or management, how do we, the question, right, Ron, they say, how do we improve the NHS? Do we need more money, or do we need to get rid of all those people that are manning essential typewriters that don't save people's lives? I think that we still look at the NHS on this sort of pedestal. I think the country has changed. I think that we have an older and bigger population. I think there are undoubtedly people taking advantage of the NHS. I think there has been mismanagement. I think it's a whole collation of things. Do you agree?
I couldn't agree more, to be honest. And not only is our population growing and aging, but expectations, particularly in people who are approaching the natural end of life, are much higher than they ever were. And then coupled with that, we've got treatments that are more invasive, more expensive. The whole thing has expanded. And we're talking not just about, the very important life-saving treatments like anti-cancer treatments, but the sort of surgery we offer people in the final years of life has become more and more invasive, more and more costly. People are spending longer in hospital, despite all of our efforts to reduce hospital length of stay, particularly when people have social care issues. They are spending often weeks and weeks in hospital, even after they're physically better.
What can the general public, this is another bugbear of mine, won't go down very well, what can the general public do to ease the pressure on the NHS? Do people turn up willy-nilly at hospital when they shouldn't?
Well, stay healthy is the most important thing. So, and thank you for having the ambulance with the Sepsis Trust messaging on there in the imagery. But stay healthy. This is about, I'm not going to say stop drinking alcohol, but do so moderately. I would possibly say try not to take drugs, but if you do so sensibly and moderately. Eat healthily, exercise. These are the most important things we can do to stay healthy. And then if we do become unwell, infectious illness is very, very common, particularly at this time of year. Most people with infectious illness do not need to go to hospital.
But I guess just jumping in, the problem is that you would, of all ages, go to your GP. And when there's 7 million people waiting to see a doctor, with respect to you, I've had it said to me, you need to go to the hospital, or you phone, and I'm sorry, I'm just going to say it. I remember when my son was a few months old, we phoned 111. My son at that age, who couldn't speak, would have been more intelligent, more switched on, and could have answered my questions better than the idiot at the end of the line. I'm being completely serious. And so I think a lot of people perhaps rush to hospital because they're not getting anywhere.
Yeah, and we have to remember 111 call operators are not clinical staff. They've had a few weeks of training, little more than that. And it's so much of this relies upon their intelligence, as you say, their human factors. Now, I'm lucky. My family can get to see our GP the same day. I live in the countryside.
Well, no, just see you. You're a doctor, man. Dad, I'm feeling ill, Dad. Can you deal with it, Dad? You don't need to go to see a GP.
So I'm an intensive care doctor. I'm of no use to anyone unless you're about to die.
Brilliant. I'll remember that. We got his number. If I'm about to die on my backside on this show, I'm phoning Ron. I'm interested, though, because what is obvious and what isn't said a lot of the time, because it becomes very easy to go, the bloody NHS. And I've said it. My father-in-law was left on a trolley for 17 hours. Absolute disgrace, right? Disgrace. Paid in all of his life. Can't have it. But I also don't go with the people that go, you need another 200 billion. I've been to a hospital recently where I was told by my mate's wife who works there that this guy comes in and they give him 2 paracetamol, packet of 60, have to throw away the other 58 because of health and hygiene reasons. It doesn't make any sense to me at all. So there's all sorts of reasons, but my big thing is we need to get it, we not only need to remove the rose-tinted spectacles and look at the problems that are in with the NHS and not feel bad about doing it, just to sum up, Ron.
I again think you're absolutely right. We spend enormous amounts of money on things that aren't directly responsible for improving outcomes and saving patients' lives. We need to improve efficiency. Now, that is not just around reducing managers, it's around making the procedures we do, the interventions we do, the treatments we do rapid, safe, and cost effective. And there's a huge amount of opportunity there.
You're my favourite person that's been on all day. We'll have you back, Dr. Wright. Anyway, just get his number in case I feel like I'm about to die. He says he can sort that out.